You may start the session now.
Okay, yeah. So Dr. Satish will start.
Yes,
Good afternoon, doctor.
absolutely. Good afternoon.
Yeah. So, good afternoon, doctors. It's our absolute pleasure to welcome each one of you to this insightful webinar. We are honored to have such a distinguished gathering of medical professionals here today. So, before we start today's session, allow me to introduce our company, Hetero Healthcare. Hetero Healthcare is determined to stay a step ahead to deliver superior and innovative care. Hetero Healthcare have established 300 product portfolio and are pioneering in quality and innovation. We also have launched 4 biosimilar products within 5 years in the market and have strong global presence in over 126 countries. So the topic of today's webinar is enzymatic preparations with Papain advantage in dentistry. To shed light on this topic, we are privileged to have Dr. Satish Kumar Menon with us. Welcome, Doctor.
Thank
Dr.
you.
Satish Kumar Menon is MDS in periodontics with 10 plus years of experience. He is the founder of Kazan Dental and practices exclusively in periodontology and implant dentistry in Navi Mumbai. He has also published various papers in the field of periodentistry. He also has a YouTube channel with 54,000 subscribers and Instagram page with 19,000 followers. He has also written books like BDS Launchpad, Dental Launchpad. So let's all welcome Dr. Menon for this session. So Dr. Menon, you can please start the session.
Thank you. I'll just get my presentation on board. 1 second. Yeah. Is it visible?
Yes, it's visible. Yeah.
Thank you. It's amazing that we as dentists make every effort to attend every program where we can gain knowledge, whether it's a Sunday morning or whether it is a weekday in the afternoon. So it's not surprising to see dentists coming and attending a program on how to improve their practice by giving medications. I would like to welcome you all on board to today's session. So, why do we as dentists make all these effort of trying and attending so many programs and sessions? Whether we are young or whether we are old, there is a continuous effort which we are making. But why is this? The motivation might vary for each and every one. For some, it is absolutely must that they make more money so that they can provide better for their families and for the society around them. Whereas for others, it's nothing but seeing that beautiful smile on your patient's face. When it comes to others, it's they just want to do more patients so they can practice more and all the knowledge they have, they can keep on giving it to their patients. For others, it's the satisfaction which comes at the end of the day. When you sleep well, you know you have changed people's life for the better. Now, what does this all boil down to? Happy patients. If you want satisfaction, respect, you need your patients to be happy. If you want more patients, you need your patients to be happy. If you want more money, again you need more your patients to be happy. So, how do we get happier patients? For that, we need to understand the psychology of our patients first, rather than just looking behind, stopping, and saying, we will do what we want and our patients should be happy. So, have you ever considered what makes your patients happy? And this cannot be the same across age groups. You might have old patients who are having various other illnesses. They are no teeth or very few teeth left and just want to be able to chew. You might have the young generation patient who's working a corporate job and wants to look better and have that cleaner, better looking smile. Then you might have kids who would be suffering from tooth pain, and their only concern at that moment is please get me rid of this pain without causing a lot of pain yourself or with less discomfort. We as dentists, on the other hand, what do we think our patients want? The most common answer is my patient wants discounts. He wants cheaper treatment, free treatment. But I want you to introspect and ask yourself the question: do you know clinics where there are a lot of patients and the dentist out there is charging a premium amount? And you're aware of clinics, on the other hand, where they are charging minuscule charges. Still, the dentist is just sitting and playing PUBG because he does not have enough patience. So it is our folly to consider that patients always come in when they want discounts. Is it always they're looking for the perfect good treatment? We have seen of treatments where our colleagues might have left the GP 3 or 4 short and the patient has absolutely no pain. But you have done a perfect RC and the patient is coming and saying, "ये दांत में दर्द हो रहा है." Now what? So is it patient looking at only treatment quality? Again, absolutely not. So what do they want? Like we discussed in the previous slide, the basic aim for any patient is basically threefold. First is function. They should be absolutely able to chew. Second is aesthetics. It should look good. And third, during the procedure and after, they should have less or no discomfort and pain. So it is should be our aim to achieve these three things so that we have happier patients, and those happier patients help us achieve what our aims are. In this fold, one thing which helps us is medications, which helps us with giving our patients less discomfort and less pain. Since we know when our dentistry started, it always started as a medication. So during extractions, sometimes during RCTs, during most of the procedures, we give different types of medications. One common reason we give a painkiller, why is it given? The NSAIDs which we prescribe is to not just act on pain, but also help solve inflammation. But what is this inflammation? Remember your Physiology 101, that book which we had studied ages ago? What does it mean? It is basically a body's response to something which is external injury, trauma, something of that sort. So anything which irritates the body causes inflammation. Now, what are the signs of inflammation? There are basically five signs. That is rubor, that's redness; tumor, that is swelling; dolor, that is pain; and calor, that is heat. Later they added a fifth sign, or loss of function or functional ACF. But we as dentists mainly have to consider the first four problems. Patient complaining of pain, swelling, redness, and irritation out there. Now, how does this inflammation occur? Let's simplify it. There are two grades. One is acute and one is chronic. But how does all this begin? It begins with, imagine you're walking across a road and there is an accident which happens. Soon as the accident that takes place out there, the people who are the bystanders out there see the accident has taken place. Whom do they call? They call the ambulance, they might call the traffic police, and they might call their friends around to come and see, witness what is happening. Now, these are known as like your cell derived people. That is the bystanders or the cells which are present out there. They act as mediators to call the rest of the people in. Now, what is plasma which passes by, or the blood vessels? It's like your road with a lot of people walking around and moving around. They see this is happening and they stop and they move into the area. This is what happens at the site of inflammation. When there is an injury from outside, the localized cells out there act as mediators and release mediators, inviting the inflammatory cells out there. Then the blood vessels have vascular permeability through which various plasma cells enter into the site. Now, these plasma cells might also have mediators, further increasing the inflammation, as well as they might try and stop the irritant or the trauma at that particular area. So, what are we as dentists to do with all these plasma derived and cell derived mediators? It is essential we understand this process and the various components. So now the cell-derived mediators have something known as histamine and serotonin molecules, as well as prostaglandins, leukotrienes, and others. Whereas when it comes to the plasma-derived, we have two systems. One is the complement activation system, which has various complements, that's C3A, 5A, C3B, and C5B to 9. Whereas you have a factor 12 activation pathway that includes two, that is the kinase system and the coagulation or the fibrinolysis system. The point is, why did they teach us all this in physiology? As a dentist, how does it even matter? You need to remember, when a patient comes to you with trauma or injury, or you're doing any extensive procedure that can be as simple as an extraction or doing an implant surgery, even giving a small suture, you are actually causing trauma and irritation to the area. Yes, the procedures you do are basically short term pain for long term gain of the patient. But what about the short term consequences when you cause those trauma? This is like Salman Khan's dialogue, Marenge bhi hami, bachayenge bhi hami. That is basically you're causing the trauma to try and solve something serious he shouldn't face down the line. Now, if you are causing this trauma, isn't it your duty to try and see post procedure the discomfort reduces for the patient? This is where your antibiotics and painkillers come in hand. But as we know, NSAIDs have some amount of effect on the inflammation, but majority is by acting on the pain pathways. So what are we going to do about the inflammation? Because after any procedure you do, the patients tell you that सूजन आया है, दर्द हो रहा है, मुंह खोलने नहीं हो रहा है. How are you as a dentist going to stop this or reduce the effect for this? For that, you need to understand how healing actually occurs. Whenever there is a trauma, the first thing which happens is clot formation. Then in 2nd to 10th day, you have an inflammatory reaction. Once the inflammatory reaction is taken care of, you have proliferative action and remodeling. So the entire problem the patient faces is in this first 2nd day to 10th day period, which we call as inflammatory period. In today's day and age, where we are trying to give better comfort to our patients, there are certain combination medicines which we can prescribe, which can help relieve our patients of that pain. And Heteropharma, being one of the leading pharma companies, are trying their best to help us and help our patients indirectly with this inflammatory process. They have come up with a medicine known as Tolib. Now, what does Tolib actually contain? It contains 4 combination drugs. One is trypsin, second is bromelain, then you have rutoside and papain. I'm sure majority of these medicines we have not heard in dentistry and during our BDS days. And majority of you have done MDS not even during your MDS days. So you would be wondering, why should I give such a combination of drug? Why do these factors actually matter when I'm prescribing a drug? So let's dive in to each and every component. The first component is trypsin. Trypsin, I'm sure all of you would have heard, it's a part of what our body already secretes. It's an enzyme created in the pancreas by the form of trypsinogen. Once the trypsinogen enters into the body in the duodenum through the pancreatic duct, it is broken down into trypsin. So this is something which our body already creates and makes. But why does it do it? It basically acts on certain functions. One, it reduces vascular permeability. Now, why does vascular permeability come into consideration in inflammation? Remember I told you in the start, there is a road, a lot of people passing by are called in and enter into the site. What happens when the police enters there? He comes there and pushes out the bystanders. Basically, you do not want people clogging into that area. Similarly, you do not want a lot of blood entering into the area due to increased vascular permeability, increasing your swelling. So how does it do it? by reducing vascular permeability. Second, there are pro-inflammatory cytokines. Remember the pathways we discussed, cell-derived and plasma-derived? In that cell-derived, we had spoken about certain factors. So there are these cytokines like tumor necrotizing factor alpha, interleukin 1. These factors act as mediators and invite more inflammatory products into the area. By reducing these cytokines, trypsin prevents further increase of inflammation out there. Now, once all the clot is formed, do you want the clot staying there for years together? Absolutely not. Once the bleeding is controlled, you want fibrinolytic activity which breaks down all the particles out there which have been created at the inflammatory site. This is where again trypsin comes in handy. Now, we know the uses of trypsin and we know it is something which is produced in our body already. But does it actually help if we prescribe it to our patients? This is a question we as dentists should ask ourselves whenever we are giving our patients a medicine or any treatment for that matter. So trypsin has already been used in various therapies by our MBBS colleagues. It has been used in chronic inflammatory ulcers, rheumatoid arthritis, and even in ocular disorders. So this is a tried and tested enzyme which when prescribed to patients have seen to help them. We have scientific articles proving it that it is helpful for the patient. So absolutely yes, we can and we should prescribe our patients with trypsin. But what about bromelain? What is this? This is a enzyme which is found from pineapple. We all have pineapple, so we know it's absolutely safe. We know that it does not cause any harm as such. But what is the positive effect of bromelain? It has, as similar to the trypsin, prevents pro-inflammatory mediators, that is those mediators which call out to the plasma cells and other inflammatory structures to come and invade the structure. It inhibits them. Second, it modulates the immune response by acting on tumor necrosis alpha and interleukin 1 beta. It also prevents platelet aggregation and coagulation out there. So the swelling which we might see reduces due to bromelain. Now, we know the advantages of bromelain, but similar to trypsin, is this drug being used or enzyme being used before? Yes, it has. They've used it in acute inflammation and in sports injuries in the medical field. They have also seen that if this medicine enzyme is given before any surgery, the healing is faster and quicker. So we know if there are advantages to giving bromelain. Then comes the third one, which is rutoside. Now, rutoside is found in plants like apple as and fruits as apple. So it is something which is easily available, and we know that it already has advantageous effects as antibacterial, antidiarrheal, anti-ulcer. It also acts as vasoprotective. But inflammation से क्या लेना देना? How does it affect our inflammatory site? It does that by inhibiting platelet aggregation, decreasing vascular permeability. This is what I told you initially. It makes the blood vessels tighter so that a lot of blood does not enter the site. It improves vascular flow. So once the trypsin eats on all the content out there, breaks it down, the fibrinolysis happens. You need vascular supply to drain out that area. It strengthens the capillaries and prevents edema. It also acts by releasing nitric oxide and prevents the free radicals out there from harming the tissue. Other than that, similar to the previous enzyme, it acts on interleukin and tumor necrosis factor alpha. But same with rutoside. Should we give it to our patients? Yes, it has been used in human arthritis and other inflammatory diseases. So we are positively sure that it has a good effect and no major harmful effects for our patients. So if our MBBS colleagues are prescribing it, why we as dentists should not provide it to our patients? And then the game changer, papain. What is papain? Papain is basically made from papaya. When the papaya fruit is on the tree, this is at the stage when it's completely green. Okay, it is basically taken out from the papaya at that stage. They give various cuts and the pulp is basically oozed out. Once the pulp is taken, it's a whitish color liquid. From that, this enzyme known as papain is derived. Now, papain has multiple benefits, not just strengthening blood vessels, which we discussed rutacide has, not just anti-inflammatory effects, what we discussed bromelain and trypsin has, it also has an antioxidant property. What does that mean? It helps prevent the further oxidation procedure out there and helps clearing up all the aggregates which have been formed in the inflammatory sites. So if there is a swelling, it helps in faster cleaning of that particular area. And similar to rutacide, it also improves microcirculation in that particular area. But we have not heard of papain. Should we prescribe it? Yes, it is used again by us MBBS colleagues for various ulcers and burns, whether it's a foot ulcer, leg ulcer, or peptic ulcer. So it is a drug which has a proven background. So the advantages Tolib by Hetero Healthcare combines these four things to give a further synergistic effect. Now we all know what synergistic effect is. You might have a star batsman, but the team might lose. It is when the entire team works together that they can easily win even the World Cup. That is what the same principle acts with these medicines. Synergistic effect is when you have drugs which work together rather than against each other. So now we know the advantages of all these four enzymes. Now, by adding them together, you have decreased capillary permeability, decreased inflammatory response, decreased clot forming fibrin deposits, improved blood circulation, increased healing, strengthening of the walls. And there are certain studies which show that it has analgesic effect equal to NSAIDs. Would I advise you skipping on NSAIDs? No. Since we know it has major effects on reducing inflammation, why should we reduce a drug? Next, it also has antioxidant properties as we discussed with papain. So giving such a combination of drugs helps reduce pain, swelling and inflammation of your patients and improves the wound healing. We know the advantages of toluene, but when should I prescribe it? Would be your next question. And what should be the dosage? It can be given after any procedure which has a trauma. For example, extractions, implants, whether you want faster wound healing, jaw fractures, regular disinfections, in all those cases, Tolib can be a game changer and help your patient from inflammatory response. Reduced inflammatory response, that is. Now, what is the dosage? It should be taken twice daily for as long as required. But what is as long as required? In our cases, in dentistry, we usually have a time frame of say 5 to 8 days where the patient has the major discomforts. So the day of your surgery, you can prescribe it and you can give it for a 5 to a 7-day dose. Now, with every drug, you're supposed to know what are the side effects. If you remember your class from Pharmac, the common side effect with all drugs is nausea, vomiting, and diarrhea. These are the same side effects which are commonly seen with TBPR protocol. Doesn't mean each and every patient will suffer it, but this is something which we should know. That's why at times we prescribe our patients with other medicines so that they do not have a stomach upset. It's similar to any antibiotic or painkiller you prescribe. But there are special cases where this drug should not be prescribed. First is if it is a female patient who is either pregnant or lactating. Second, someone who is in warfarin blood thinning therapy. Because we had discussed before, these drugs help clean out the site. So if already your patient is on a blood thinning protocol, you do not want to increase the effect. Second is if the patient has certain sedatives which are given by the patient, by the dentist himself for the major surgery, or the patient is taking it on a regular basis. In such conditions, you should avoid this drug. Other than that, it is a very beneficial drug which you should prescribe to your patients if you are assuming that they might end up with a lot of swelling and pain. We should always, as dentists, be proactive and try and keep our patients happy. Because as we spoke in the start, the bottom line for achieving all what we desire as clinicians is having happy patients. And happy patients means keeping them with less pain, less discomfort, and happier. So if there are any questions, I would like to take them.
Participant doctors can type in their questions, which will directly come to the Dr. Satish. If you have any questions, you can type in. Since anyone has any questions, they can type in. Type your questions, it will directly go to Dr. Satish Kumar.
I don't think there are any questions.
Yeah, no questions are lined up. So, yeah, Dr. Satish, thank you so much for the knowledgeable and insightful session, helping us understand TOLEB in a better way. And thank you for your time as well. Thank you so much. Yeah. Thank you everyone for joining in. Thank you, doctors, for joining in. Yeah.